The topic of this evening's webinar is Skin Tightening Misconceptions Explained, presented by Dr. Karyn Grossman. Dr. Grossman is on the line with us. Welcome, Dr. Grossman.
Thank you. Thank you guys all for having me this evening.
Wonderful. We're delighted to have you. Dr. Grossman, Dr. Grossman is a board-certified dermatologist. She specializes in cosmetic dermatology in Santa Monica, California, and Manhattan, New York. Dr. Grossman received her medical degree from Boston University, and she completed her residency and fellowship at Harvard University. Dr. Grossman presents clinical studies at the American Society of Dermatologic Surgery, the American Society of Laser Medicine and Surgery, the Foundation for Facial Plastic Surgery, and the American Academy of Dermatology. We would now like to turn the webinar over to Dr. Grossman. Dr. Grossman, please go ahead, and we are going to pass the ball to you right now.
Okay, thank you very much. And attendees, I'm just going to say I'm a little sorry. I'm recovering from a cold, so I'm working with some tea not to work on my cough. So I think the big issues that we're going to look today are really the mode of action of thermage, myths that are around versus skin tightening and thermage, the myth that these devices do not work, that it's painful, and that all devices are created equal. And at the end of the meeting, we'll have a chance to go through some of your questions. So please make sure if you do have questions that you do type them in. So we're just going to review pretty quickly how is it that thermage, which uses RF, works. So basically, if you look at this diagram, it's a diagram of the skin, and you see the epidermis, dermis, the subcutaneous fat tissue, and the muscle. And what the thermage device does is it actually cools the epidermis while it transmits heat with the RF down deeper. And that heat then is also transmitted through the fiber septate in the subcutaneous fat tissue. And the cooling area helps to protect the epidermis from damage. Okay, why does this not want to advance? Here we go, sorry. So why is this heat that's being transmitted into the dermis important? And what the thermage device does is it does bulk heating of the dermis, and it's a deep volumetric heating. And what the heat does is it takes your collagen triple helix molecule, which is here, and it denatures those collagen fibers. So what do you see immediately in a patient? You can see some immediate collagen contraction. You have water molecules that are separated from collagen molecules, which cause the collagen to denature, and you get this kind of instantaneous tightening. However, it's really the long-term results that are most impressive, and that's because you get a secondary wound healing response. And with this, you see new collagen deposition and remodeling of the dermis. The tightening happens over a period of time. So I typically tell patients that it takes about 3 to 4 months to see the final results, and that you actually can increase the collagen density over time. These results were actually presented by several presentations by Dr. Zellickson, and I also had done some presentations at the ASLMS looking at the deposition of new collagen fibers. Now, there have been a lot of questions about what is the difference or what is similar responses of radiofrequency versus ultrasonic treatment of the skin. And in particular here, we're looking at a fractionated approach to the ultrasound treatment. So the thermage, as we talked about a minute ago, you have the epidermis. You get this bulk heating of the entire dermal tissue here, with energy also sent down into the fiber septa of the dermis, which causes, of the subcutaneous tissues, which can cause contraction. And here you see a picture which looks at the heat with the tissue touching, and you see the heat here really evenly spread out into the dermis. Focused ultrasound systems work differently. What they do is they take energy and they focus it into a point to cause an individual small wound within the skin. And in particularly in the Ulthera model, they look at targeting 3 different depths of treatment. The 4.5 millimeter head, which puts small injuries into the tissue of this mass. Another row of injuries at 3 millimeters, which they hope to get into the deep dermis and maybe into the fat and connective tissue. And then a third pass at 1.5 millimeters here up into the dermis. And with Thermage, you treat a continuous band of tissue, and with ultrasound treatments that are fractionated, you get these much hotter but focal areas of damage to the skin. So one of the myths is that skin tightening devices do not work. And I know a lot of people out there actually believe that, but that's not what I believe. I tell my patients in my experience that about a third of patients get great results, a third of patients get medium results, and a third of patients get small results. And unfortunately, I can't really tell you where you will fall into that unless you've actually been treated before by me. Because I know if I've done it and I've put enough energy into it and you got small results, that you're not likely to then get more results on a later treatment. But what we know is that it's been scientifically shown and proven that bulk heating actually helps, to increase collagen production in the skin. The current wave of Thermage technology is the CPT, which is right here, and then you can see the one prior to that was the NXT. And I will tell you that I have actually had Thermage systems from the very beginning, and that you do get better heat distribution in the CPT system, although, and we'll get to it later on, you actually do get less pain with it. The next thing that I want to address with the myth that skin tightening devices do not work is some scientific look at collagen expression. So in this particular study, patients were treated and they were tested prior at 7 days and 30 days, and the expression of collagen 1 and collagen 3 was looked at in the tissue. And what you can see, if you look at this graph here with collagen 3, is that you got a significant uptake in the amount of collagen 3 expression both at 7 days and at 30 days. So we know that this continued collagen production actually goes out to at least 30 days, and we do actually have studies ongoing further to look at dates out from that. And if you look at the p-values, you do have a nice p-value, even though the n is small, of 0.01. So here you can see that there's roughly 140 to 160% increase in the amount of collagen 3 in the tissues. And this is very good evidence of neocollagenesis and prolonged dermal remodeling, which leads to further skin tightening. Well, I think one of the reasons that people have is they sometimes treat the wrong patient. So when Thermage first came out, people thought that Thermage was going to replace a facelift. But Thermage doesn't replace a facelift. It doesn't replace a surgical procedure for somebody who has severe laxity in their skin. But it's ideal for patients with mild to moderate laxity who want kind of a smoother, tighter look, a mild reductions in fine lines and wrinkles, and overall tightening of the skin, and they don't want surgery. So you can see this woman here. She has a little bit of heaviness of the brow and the upper eyelid. She has a little bit of mild jowling through here and some looseness in the submental area. This woman here, if you treated her with Thermage, she's not going to get a big difference. She probably needs a CO2 laser resurfacing in order to get a dramatic reduction in her wrinkles and lines. So here, this is something that I would say is typical of somebody who had kind of small results. If you look here at her nasolabial fold, it looks a little bit better. One of the things that I like to look at is this kind of malar area in through here, and you can see that she's had some improvement of that nasojugal trough there and in through here. And you can see she has a little bit of looseness and laxity along the jaw, and it's just mildly improved here. So this is what I would say is typical of somebody who has a very mild response to the treatment. However, treatments can also be very impressive. This is actually one of my patients, and this was a 50-year-old woman who you can see how she has this extra fold of skin on her upper eyelids, and this is her 8 weeks after the treatment. And yes, she is wearing makeup during this time, but you can really see how she has a dramatic reduction of that extra fold of skin on that upper eyelid, and her eyes appear more open. It's often hard to follow people for a prolonged period of time because they often do a lot of other things in between treatments. But this is somebody who really had no other treatment and came back to us 2 years later. And you can see that 2 years later, she's beginning to get a little bit of that recurrence of that skin on her upper eyelid. And while she's not as good as she was 8 weeks prior to the treatment, she is actually much better 2 years after the treatment than she was prior to her treatment. So what I tell patients is when you respond and you get a good result, you can anticipate that there is some lasting time to that result, but that unfortunately we all continue to age and the clock moves forward. We can only turn it back some, but we can't stop it. This is actually a picture of me, and I actually am one of the earliest not only Thermage users, but recipients of Thermage treatment. This photograph was actually taken right before my first Thermage treatment, and I was actually treated with the very original machine on my forehead area. And the reason this was appealing to me was because during this photo shoot, lots of people, i.e. the photographer, was complaining that my brows were too low and that I was raising my eyebrows, which then created wrinkles along my forehead. And he's like, no, raise your eyebrows some, but not that much. So I happened to wander into Dr. Weiss's office because I was lecturing at Johns Hopkins, and he was doing the clinical trial for Thermage, and I was looking at some of the results he was getting and told him I wanted to be the next trial patient. And this is me 8 years later in my office with no makeup on and my hair back, just because that's how I typically go to work. But you can see that there's a definite improvement over 8 years and after 5 Thermage treatments in the height of my brows. And I have no Botox in this picture or in this picture. So that is, it does not actually change the results. But you can see I have much more show of my brow bone here than I had prior to that 8 years earlier. So again, I do believe that Thermage does work and that you actually can get improved results over time. When I have to address the question for my patients, well, how long does it work? I say, again, because of aging, it's really hard to know. But I had the fortune of actually treating a 16-year-old at one point, and this is a photo of her. I don't typically treat children, but this girl came to me from Saudi, and she came to me because she had been bothered since she was born with this congenital extra fold on her upper eyelid, and she and her family really didn't want her to have any surgery to correct it. We treated just the left eye, and we found a few months later that she had a very nice improvement in that area. She was no longer taunted at school and was very happy. 2 years later, when she was 18, she came back to visit, and what was really nice to see is that correction was maintained. So in this particular case, I was actually able to take the variable of aging out because people between 16 and 18 don't usually age, and you could see that she had a very nice result 2 years later, even after the treatment. So One of the other things we want to address is that more than 1 million patients over the past 10 years have been treated with Thermage. And that I find in my office, patients who have used Thermage and who have been happy with it love to come back because they really feel and they look at it as kind of a key to preventing them from having to do a more invasive and more aggressive procedure later on. I kind of show patients myself and I say I'm 46 and I'm going to be very happy if I can do Thermage every year, give or take a little bit, and hopefully I can put off doing a facelift or a more invasive procedure later on. It is the first and only device that is cleared for eyelid treatments. While there are other non-invasive tissue tightening technologies out there, they are not able to treat eyelids. And I actually find that eyelids are one of the most beautiful areas that we actually can treat. We get nice results with it. There are over 73 patents that have been issued to Thermage on the unique radiofrequency technology, and there are 58 applications that are pending. Thermage has been studied in more than 50 peer-reviewed articles, so it is an accepted technology, and there are over 1 million treatments that have been performed with 2,500 physicians worldwide offering the treatment in 80 countries. So if Thermage didn't work, there wouldn't be that many people out there doing it and continuing to do it successfully. The second myth we want to address is that skin tightening with Thermage is painful. And I will tell you, since I have been the recipient of all of the Thermage technologies over time, I can give you firsthand testimonial to that. And I will tell you that the first generation was quite painful, and even NXT was somewhat uncomfortable. But I have now been treated and used the CPT technology since it has come out, and am very comfortable having a 900 tip done on my face, and I don't jump. Well, there might be a few little hot spots. Being able to actually calibrate the temperatures to being hot but tolerable, and telling people they'll have a few hot spots that they have to get through is very effective. We do not give our patients Valium. We do not give our patients narcotics. We do typically give them an injection of Toradol in the arm to help with any discomfort, but we have many patients who don't even do that. Here is a study that looked at the CPT, or the Comfort Pulse technology, which is the vibration, and what that does is that actually doesn't allow the skin to sense the heat as much because the vibration is going. And you can see that every patient, when there was no vibration versus the vibration, actually decreased their discomfort score. The other interesting thing about CPT is that the technology was optimized to produce the tissue heating below the bulk of the pain receptors. So what we're looking to do is to create a thermal profile that produces this deep tissue heating below the first 500 microns of tissue. And what this does, it allows the tissue to heat up in a plane where there is efficacy, but a lesser amount of pain receptors, so there is less pain perceived by the patient. And after each pulse, the dissipation of heat is conducted upward, which actually then further decreases the perceived pain. One of the things that we also used to do is use numbing creams and gels to actually decrease the pain of the procedure, but it was also shown that when you don't use topical anesthetics, the patients actually feel the cooling of the tip, and that is actually more comfortable for them. The third myth that we'd like to address this evening is that all skin tightening devices are created equal. And I think that is probably in some ways the most difficult myth to address, there have been several systems over time and several studies done over time to actually look at comparing thermage, which is still considered the gold standard, to other devices. So at one point, Titan laser was a very popular laser out there that was looking at tissue heating and tissue shrinkage. And Dr. Lee up in San Francisco did a very elegant study where she did a split-face study and showed that while you could get equivalent results with both treatments, it took on average 3.5 Titan treatments to be equivalent to one thermage treatment. And since each Titan treatment took approximately 3 times the amount of time per treatment, that a patient and provider was looking at a kind of 9-to-1 time change to get equivalent results. More recently, Dr. Zellickson has presented abstracts at ASLAM where, again, he's done a split-face study looking at treatments with Ulthera and with thermage, although he did use the thermage NXT for that study. And in that study, he did find that there were no statistical differences between the outcomes, so that he had a statistically equivalent result on both the thermage side as well as the Ulthera side, although that paper has not come to press yet. So when we look at tissue heating, what do we want to look at? One of the things that we want to look at are temperature and depth, but they are not the only important things. So what we know about thermage treatments is that it heats the deep tissues to almost 45 degrees Celsius. This induces a transient denaturation of the collagen via heat shock responses, which then is part of the wound healing process and leads to new collagen formation. And by bulk heating the tissues, we have a more even and greater amount of tissues that are going through this. And this treatment is more advantageous because all of the tissue is treated, and you can use lower temperature profiles to achieve efficacy without having to resort to much higher temperatures and more pain. So if you look at wound healing here, you see initially some inflammation, proliferation, wound contraction, and then collagen synthesis, which it peaks somewhere from 3 days to 4 weeks, and then you get remodeling for 3 weeks up to a year after treatment. The other thing that people think might be true is that the higher temperatures are needed to achieve similar clinical results. So some other devices, which actually can reach temperatures up to 65 degrees Celsius, which is where full denaturation occurs, can actually cause some lethal damage to cells. This actually results in more pain, swelling, and discomfort, as well as injury. So, for example, in the Ulthera treatment, there have been some reports of nerve, at least trauma, in areas which at this point have all resolved but are often disturbing to both the physician and the patient while it's going on. Another myth is that greater depth produces greater results. And so treating the SMAS, which is the apertenotic layer, and which is what plastic surgeons pull when they do a facelift, which was why it was originally targeted, does not necessarily mean that you'll get a better result than just treating the skin. And in fact, if you look at the protocols for fractional ultrasound devices, you treat the SMAS and you need to treat areas within the dermis and in the subcutaneous tissues in order to get results. So as long as you get the entire region of the tissues being heated, the depth of the treatment doesn't seem to be important to get results. When you use fractional treatments, you get these small areas of intense injury, which leaves much of the tissue around it untreated. However, again, having greater injury deeper does not mean that you actually get better results, but you may be at better or greater risk of pain and nerve damage. So tonight, I hope you all learn to actually remove fact from fantasy, and we've done a few myth-busting this evening. The first myth being that skin tightening devices do not work. They do work, and it has been scientifically tested and proven that bulk heating the skin does cause new collagen to form and tightening of the skin. However, when you do these procedures, it's important to choose the ideal candidate and to manage their expectations so that a patient who will not get improvement for it is not treated, and that patients understand they may have more mild to dramatic results. Over 1 million patients have been treated in the past 10 years, and many of those are repeat customers. So if it didn't work, people wouldn't be coming back for more. The second myth is that skin tightening needs to be painful. I will tell you I've also had Ulthera treatments performed on myself, and the amount of pain that I had with that was pretty equivalent, if not worse, to the pain that I had with my original Thermage treatment in 2008. However, the CPT, which is the Comfort Pulse technology, is been shown to significantly decrease any pain and to improve the tolerance of the procedure. We used to give narcotics and Valium to treat people. We do not need to do that any longer. And the other nice thing about the Thermage CPT is that the technology is optimized to produce most of the deep tissue heating below the bulk of the pain receptors, so that, again, by putting the heat in an area that has less pain receptors in it, it tends to be less painful. The next myth is that all skin tightening devices are created equal. Skin tightening devices that are currently available may do things, but they often do them by different methods. So while people think that temperature and depth actually are the only factors that matter and affect outcome, we have seen that they don't. And that when you use fractionated devices, you do need to go to higher temperatures to achieve some results, but when you bulk heat the entire area, you don't need to go to such high levels to actually get similar results. And that, again, greater depth does not equal a better result, but it may actually result in a greater risk of side effects or potential nerve injury. So I'm going to pass this back to the Solta Marketing Group, and they will look to see if you guys have any questions that want to be answered.
Great. Thank you, Dr. Grossman. That was wonderful. We will be taking questions now, and we have several that have already come through. Once again, if you have a question, please type it into the chat box, which is located at the right-hand side of your screen. And the first question is, you mentioned that there is no pain during a Thermage treatment. I find the opposite. Please address your settings.
Well, I didn't say that there was no pain. I said that it was well tolerable. I actually ask my patients to give me feedback. And so what I tell a patient is that it should be hot but tolerable, and that if it's not hot, it won't work. But hot doesn't necessarily mean pain, and I do tell them that they will have a few hot spots, and that those are the hot spots that they just kind of have to get through. And those hot spots are relatively predictable on individuals, although of course there is some individual variation, and that they just have to suffer through that. But if you are working at a level that is actually causing a lot of pain, then you are working at a level that is too high. And again, early on, 10 years ago, we worked at those levels, but it has been well shown that if you reduce the energies going in to a hot but tolerable level, and you do multiple passes over an area instead of a single pass, that you actually get better results with that type of treatment than you do with those very, very high intensity treatments with Thermage that caused a lot of pain. And again, I can tell you, having been a patient, both from the TC3, the NXT, and the CPT, that the amount of pain that I have experienced during that time has decreased. My first TC3 treatment had less than 100 pulses, and I was done. And now I can do 900 on my face and not have any issues with it. Again, that's not to say that I may not have a few hot spots, but certainly a few hot spots are very easy to tolerate.
Thank you, Dr. Grossman. Okay,
You're welcome.
The next question is, at one point in training, we had been told to pinch the skin around the jawline while treating to reduce discomfort in this area. Does this have any adverse effect on the results?
That's actually not something that I do, and mostly because I find that while it is more uncomfortable along the jawline, sorry, in general, that because most of the treatment is actually quite tolerable, that patients can tolerate that very well. And I think that there is no good study to show whether lifting it up to pinch it helps or actually affects the treatment. I think everybody that does thermage over a period of time kind of develops their own kind of little pushes and pulls on things that seems to work well for them. And while I can't guarantee you that it wouldn't adversely affect it, I'm not sure that I could think of why it would, because again, with thermage treatments, you are looking at putting the heat really into that dermis and sending the energy down into the subcutaneous fibers. And maybe if you've lifted it up, you might get an alteration in that, but you at least get all the dermal heating.
Great, thank you, Dr. Grossman. The next question is, what is the optimal treatment parameter for eyelids? How do you optimize the treatment result for fine lines of the lower eyelids?
Well, it's very hard to say what the optimal treatment is because I find that every patient actually has a different pain threshold. So for example, today, I treated a woman, and I actually do my eyelid treatments a little differently than what is recommended by the company. I use the 450 tip divided in half from the lash line to the eyelid crease on each side. And again, I will push the patient to whatever setting allows them to be hot but tolerable. Most patients have two hot spots on the eyelid, one in the medial corner and one in the lateral corner. We tell patients about that ahead of time, and they know when they hit the hot spots, and they know 1 or 2 pulses later they'll be back into the hot but tolerable phase. I then either use a 100 tip or I use a 100 pulses from another tip, and I then raise the eyebrows and treat underneath the eyebrow itself and just into the eyebrow, alternating back and forth from side to side doing that way. And I have found, and by the way, I do keep the eye shields in for that second part of the treatment as well. And I find that by using those 2 tips and putting that amount of energy in, that I typically get a very nice result in the eyes. There are some patients I may use more than 100 pulses in that area. I may go up to 150 or in rare cases 200 pulses in those areas if a person has a tremendous amount of laxity on the upper eyelids but does not desire a more invasive or aggressive treatment. I typically don't actually treat the lower eyelid with thermage for fine lines. I typically tend to treat those areas with lasers, so I'm not sure that I can really give you a protocol to optimize the results in that area.
Thank you, Dr. Grossman. The next question is, how much more of a clinical improvement of CPT do you see compared to the NXT or TC3 and also versus Ultherapy?
Well, we had Ultherapy here for a day, and we treated several patients who were prior thermage patients. So these were people who kind of knew the pain expectations, who knew the result expectations. And what we found was that the Ultherapy treatments were much more painful for patients, and they really didn't seem to get better results. my idea of going into it was that if I could tell a patient, wow, this is going to hurt a lot more, but you're going to get better results, you can choose between more pain and better results than less pain and less results and give people an option. But what I discovered was that we were getting a lot more pain, but really no different results than we were getting from the thermage treatment. And that was both from my observation in addition to the observation of the patients. That being said, I do think that Ulthera works. I'm just not sure that I can justify to my patients a lot more pain for similar results. I do think, again, having been an early adopter to thermage and going from the TC3 to the NXT to the CPT, it's a little bit hard to tell, but I do think that I am overall getting better results with the CPT than certainly I was getting with the TC3 and probably with the NXT. And I think that's because with the introduction of the Comfort Pulse technology, patients are really much happier to sit there and let me put 900 pulses into their face with really not being aggravated or frustrated or giving me a hard time or asking me to lower the energy a lot. One of the things that you do need to be aware of, though, with the CPT is there is much more efficient transfer of energy to the tissues. And it's not unusual for me to find, while a patient may have been at one level and was doing fine during it, about halfway through a treatment in that specific area, they may find that all of it is now feeling too hot and that I need to bring it down about a half degree or a half number. Most of my patients I try to start at 3.5, and patients typically vary, on the face from 4, maybe down to 2.5 in people who have more sensitivities. And obviously when you go down onto the neck, people are more sensitive and you have to lower the energies in those areas as well. But what you do want to do is really treat patients until you see a change there. Sometimes people don't put enough pulses in. So I would never treat a full face with less than 600 or 900 pulses. And there have been times where I'm not quite where I want, and I may pull out another tip if I've underestimated what they would need to get that result. So if you let a patient up off the table and haven't really put enough into it, you'll have a harder time getting results. There was a laser nurse who worked for myself and some other people, and the first time she saw me do thermage, she looked at me and she goes, "Wow, Dr. Grossman, I've never seen anybody go at it the way you do. No wonder you get so much better results than the other people that I've worked for, because they're not doing nearly as much as you are."
Great. Thank you, Dr. Grossman. The next question is it necessary to see erythema and swelling before seeing a good result? Many people feel hot but have little erythema and swelling, or many patients.
Well, I would say pretty much every patient that I have is pink when I'm doing it. And again, that may be because I put more pulses into the area than maybe you're putting in if you're not seeing some pinkness. I do find that people have a variable amount of swelling, but that I would say every single patient is pink while I'm doing it. My treatments, I divide it by regions. So on a face, I would start with the forehead, do one cheek and then the other cheek. By the time I finish the whole face, the forehead would only be very minimally pink, but it would definitely be a pretty bright pink at the time it was treated. I will say that 99% of my patients are Fitzpatrick type skin types 1 and 2, so I can't really tell you with darker Fitzpatrick skin types, in which case it is more difficult, obviously, to see the erythema in the skin. But certainly with all of my patients, I do get definite erythema with it. Some patients, some swelling, and I think you probably need to put that amount in of pulses to get a result. Maybe if you're not getting that, you're not putting enough pulses in, or you're not really getting the patient to a hot but tolerable point.
Okay, great. Thanks, Dr. Grossman. The next question. The next question is asking, they're interested to know the typical setting levels or the range for a full face that you typically use on a patient.
Again, typically what I would do is start a patient at about a level 3.5, and I find that's a good starting place. I always start my pulses on a face on the middle of the forehead, going in a vertical line, because I find that patients tolerate that the best, and that they are over their fear by the time we get through that line. Sometimes patients are concerned that they're going to have pain, so they have a little bit of anxiety early on in it, and then once they kind of know that they're going to be okay, they tend to relax. Again, and what I'll find is that patients will typically tolerate about a 3 to a 4 on the forehead, the lower part of the face, you know, maybe a 2.5 to a 3.5, although occasionally I'll have a patient that goes above or below that. And in the submental area, those people I typically bring down to anywhere from a 1 to 2 levels. And again, I typically put, you know, at least 600 to 900 pulses into a face to get, you know, enough pulses in to make a difference.
Okay, the next question is, how do you market your thermage?
I think I'm in a very unique situation. We do very little marketing in this practice. I would say 98% of my patients are word-of-mouth patient referrals from other patients. And patients send their friends in for thermage, so it leads me to believe that those patients actually feel it's a successful treatment. We don't advertise. We do have a website, although that website hasn't been updated for many years. But I know that if you have issues regarding marketing, that your sales rep can help you. They have a lot of tools and kind of tricks in the trade in order to help you get patients into your office for thermage, and in addition to getting your own patients that are already there in for thermage or back in for thermage.
Great, thank you. The next question is, will clinical results deviate with the vectoring method?
I'm not sure I understand that question exactly. Certainly, the use of the vectoring method has been a well-tried way of doing thermage, and people, you know, across the world have found success to it. It is, I think, the basis for what people should do for all their treatments. There may be some things that, again, once you become more experienced, that you may do to alter or change things a little bit. But again, that vectoring method was born out looking at many different users and looking at different results and really coming up with a consensus on what seems to work best.
Great, thank you. The next question, do you use face tips on the body, or do you use the body tip on the body? Which gives the best results?
I actually have never tried the face tips on the body, so I'm not sure that I can give you an opinion about which gives the best results as far as that's concerned. I think when you are looking at body treatments, unlike the face, where many patients can sit up and actually see a difference in their face during the treatment or at the end of the treatment and really kind of have that wow effect, so that then they are much more willing to wait those 3 to 4 months to see their final results, that when you don't see that on a body treatment, and you really have to educate your patient ahead of time about needing to wait time to see results. Because if your patient is coming back in 3 to 4 weeks saying they don't see a change, they're not going to see a change. So while we certainly do reach out to our patients during that period of time, we typically have them come back at 3 to 4 months to then look at results. And if they say that they haven't had results prior to that, again, when we reach out to them, we remind them that it's going to take them at least that amount of time. So I think, again, especially on body, you do need to give people appropriate expectations, or they will initially be disappointed, even though later they may have a much better result.
Okay, great. So the next question is, it's a two-part question. Do you ever use 900 pulses on the upper eyelids, and do you ever use more than 900 pulses on the face?
So on the upper eyelid itself, which I use the small quarter centimeter squared tip, I actually don't think I've ever actually used 900 pulses on a single eyelid. The most amount that I have used from the lash to the lash line on a single eye is 450 pulses. And that is only when I have a very asymmetric upper eyelid situation and I'm trying to create more symmetry in it. So I can't tell you, about doing more or less than that. I then use the larger tip again and go on to underneath the brow area, and I will put somewhere between 50 and 100 pulses alternating side to side in that area. So it never adds up to what I have done to be 900 pulses or above. I have never had the opportunity to put more than 900 pulses in a face, and that might be because I'm pretty careful about the patients that I select to do this. I think if I were going into planning ahead of time that it was going to require more than 900 pulses, that I would then have to reconsider my choice of this as a treatment for a patient. And is that patient really more suitable to a surgical intervention? That being said, I do have patients who are clearly more suitable to surgical interventions who will tell me, I'm never doing a surgical intervention and I want to try. And I have to say most of those patients don't have dramatic results, but I don't expect them to, because if you're in bad need of a facelift, I don't think thermage is actually the right choice for you.
Okay, great, thank you. So we're just going to take one more question. And this question is, how often or how likely is it that a patient will suffer a blister or a burn or a surface irregularity, and what should I look for before this were to occur?
Well, certainly all of those things have been reported, and I will tell you since I have started doing thermage, I have had 2 patients over the years who've had a little bit of scabbing on the skin. The first patient was from the original TC3 treatment, and she had some squares on her face that had a little bit of epidermal change. Those actually all resolved without any issue. And I think there was probably something potentially either something on the skin that we didn't clean off appropriately, or something along some other reason that there were a few little squares. I've had one patient with the CPT technology who also has had a little bit of scabbing on the face, and that was actually kind of some irregular patchy scabbing on the face after treatment. None of those patients actually showed any change during the procedure itself, so I wasn't aware of it. Early on, when people were using numbing cream and they weren't cleaning the numbing cream off, there were some alterations in the conduction due to the residual numbing cream and the gel, and I do think that is where initially some of this kind of scabbing and blistering occurred. And again, in the amount of time that I've been doing it, I've seen only these 2 patients, and both have healed without any consequence with it. If you think about other types of surface irregularity that has been reported, early on there were some people who reported fat atrophy from these treatments. I actually did a study looking at abdominoplasty skin that was reported and presented at ASLAM, and found that if you triple pulse and you turn the energies up very high, you did actually get destruction of the fat cells below the skin. And most of these patients that had fat atrophy by a handful of physicians, and most of these people actually put patients to sleep so that they could crank up the machine high in their idea to get better results. However, I am not aware of anybody who has had true fat atrophy when a patient is awake and when they are titrated to the hot but tolerable range with the treatments.
Great, Dr. Grossman, thank you so much. That was a wonderful presentation with much valuable information, and we're very grateful for everything you shared with us today.
Thank you all for having me, and I hope it was helpful to all of you who are listening to this presentation and watching it.
I'm sure it was. And also, we would like to remind everyone that our next webinar will be on the Clear and Brilliant Laser System, and that is scheduled for Thursday, January 24th, 2013, and it will be presented by Dr. Susan Van Dyke. And we would like to thank everyone for attending the webinar this evening, and also again, once again to you, Dr. Grossman. So thank you, everyone, and good night.
Good night.